why universal healthcare would be cheaper for Washington State. The USA is number one in healthcare spending, even adjusted for price purchasing parity and for GDP per capita. The US spends significantly more than comparable countries. We're that green dot way above the trend line there. And despite this, health spans in the United States underperform comparable countries by 2, 3, 4, 5, even 6 years. Why is it more? We spend a huge percentage of our GDP on private healthcare. From that graph, you can see that the public healthcare spending is actually quite similar to comparable countries, where the private healthcare spending is off the charts. And where is that private healthcare spending going? It's going to our insurance companies like United Healthcare, which has seen a huge increase in its stock price since the early 2010s. The cost of administration is way cheaper under our currently existing single-payer model of Medicare than it is under private insurance. Where does the single-payer savings come from? The biggest buckets single-payer savings comes from are provider administration and insurance administration. The next biggest comes from market power, being able to negotiate better rates. Fraud is the next biggest category. Single payer is simpler than what currently exists. And lastly, employers would no longer have to negotiate with insurance companies to come up with plans for their employees. Some analyses done on the Washington Health Trust have shown that it will save money, including that the Washington Healthcare Authority found that statewide universal healthcare would save between $800 billion and $2.5 billion while it's being implemented. And then once it's set up, save up to $5.6 billion annually, which is a 7% savings. And an analysis done by Dr. Gerald Friedman estimated between $5 and $13 billion annually. It would be cheaper despite covering every Washington resident with great healthcare. This healthcare would be better for most people. In Washington, about 7% of our residents are uninsured. These people would be covered under the Washington Health Trust. We would be able to eliminate 7,000 medical bankruptcies and 7,000 avoidable deaths annually. Want to have universal healthcare? Check us out at wholewashington.org.